Hey everyone, I'm Brendon Ip here from Ip Physio, and today we're going to go over a stability exercise for the lower extremity. So, for those of you who have suffered a lower body injury, right, including the hip, the knee, or the ankle, this exercise might be for you. If you're suffering from a specific injury, please contact a registered physiotherapist or other licensed healthcare practitioner to get an appropriate diagnosis. But if you have been suffering from this injury, having it taken care of by a professional, and you're looking for some additional strengthening and stability exercises, then this exercise might be for you. So typically what we want to do is we want to engage the muscles post-injury to make sure that they are activated the right way when we engage in sport or activity again. For this exercise, all you need is an exercise band. So here I have an exercise band, typically a round rubber tube. You can do this with a flat band if you want to. It's personal preference. I use a round band solely because there are clips and it makes the exercise easier. If you have a flat band with free ends, you might just have to hold it at your waist or tie it up, okay? But either way, it works. So typically the setup is that with an injury, perhaps when you apply force or weight bear, right, maybe there's some buckling inwards, right? Maybe you have, knock knees or genu valgum, which is, collapsing of the knee inwards, and that's maybe causing some, asymmetrical stress on the knee. So something like that would benefit from this kind of exercise because it cues the muscle activation to keep a proper alignment. So what I do here is I put my band below my kneecap, okay? I make sure my ends are even, okay? And I put this below the kneecap. I then cross over behind me, okay? So cross over behind, right? You should be able to see an X pattern, okay? That's how you know that the crossover is in the right spot. Do a little bit of adjustment if you need to make sure that the band is fitting the right way, not rolling up or down, and crossing over properly. From here, I take a narrow stance so that I have some slack on my exercise band, and I pull it over to the front of my waist, and this is where the tube comes in handy, because I clip it in, so I don't have to hold the band using my hands, so I can go hands-free. From here, what I do is I readjust, but I maintain my positioning where I'm boxed and framed out, okay? So notice that the band is crossing over behind and is underneath my kneecap, but it's also in front of my hip, and the pull of the band kind of pulls everything together and collapses my joints. The reason for this is that when we apply this pressure, it cues the inside movement to drive outwards. So as it pushes me in, it drives my VMO, my vastus medialis, okay, the inside muscle in the knee, to activate and push the knee back out. It also helps my glute med, my side glutes, that stabilize to help pull and frame out using my legs, okay? So this can be for anyone who plays a certain sport like soccer, basketball. It can be for runners or it can be for weightlifters, okay? Even as I stand here, I feel like I have to maintain this firm base of support in order to stay safe position-wise for the knee. So what I can do here is I can watch TV, I can stand here, I can do squats in this position, and while I'm doing this, all the muscles in my knee, my hamstrings, everything's engaged. I can also practice a run. So I can run on the spot, okay, and engage all the muscles really well, okay. I can do side steps, okay, to help work on the side stability and work on my glutes as well. And it's more of a pull than if I just put a band outside my knees, okay. This band is like around my knees, it's around the back, it's around my hips. It engages a lot more muscle when I do this, okay? I have some patients who are maybe even martial artists, and so they prop this up in their living room, and what they do is they can do a little bit of shadow boxing, okay? So you keep this safe positioning while making sure that all the muscles are activated to help frame out and prevent any future injury associated with instabilities of the lower extremity. Okay, so enjoy this one, take some time, practice it. It takes a little bit of time to get used to the feeling, but move around with it, have a feel, and feel all the muscles engage. Thanks.